Chapter 3, Part 2. So now we're going to get more into the pharmacokinetics of drugs, and that is the study of how drugs move into, through, and out of the body. It's important to know because we want it to be absorbed well, get into the body, do what we need it to do, but we want it to go away at some point. So there are four basic steps in pharmacokinetics. And there's an acronym, of course, for it, and it is ADME. If you can remember that, you're probably going to see that again, maybe on an exam. And so those four steps are absorption, that is getting the drug into the body and into the bloodstream, distribution, getting it to different parts of the body, hopefully to the part of the body we want to affect, and then metabolism, which can be part of getting the drug into a form that then is distributed into the body again and has its effect, or it may be the beginning part of the excretion or elimination of the drug. So excretion or elimination, I look at both of those as being the same. So if you can just remember the E and then come up with one of those, you're fine. But those are the four basic steps, and we're going to start with absorption. So when we talk about those steps, we need, again, to consider what animal we're looking at and what are we talking about. So if you look at these two patients, they're both pretty neonatal. That foal is probably just a few days old, and that kitty cat is, probably it's a little bit older, I should say, because its eyes are open. So sorry about that. It's not as young as the other one. But anyway, these are both neonatal animals, and just being neonates doesn't necessarily put them in the same category. While both of them, their liver and kidneys are getting up to speed, and that will have an effect on those steps. And this is just one example, but the foal, interestingly enough, gets its liver enzymes really pretty quickly, pretty early on in the first day or two of life. And the kitty cats don't tend to metabolize things the same way that other animals do. They lack a significant metabolism system. And so even if that kitty cat was older, it's not going to have the same ability necessarily to metabolize drugs. So we have species differences, we have health conditions that may affect that. We may have compromised cardiovascular systems that would affect both the absorption and the distribution, not to mention metabolism and elimination. So we need to definitely look at the critter that we have in front of us as we're thinking about how a drug is going to work in them. So absorption. Absorption is the movement of drug molecules from the site of administration. So whether we're administering it orally or topically or injecting it in one manner or another, and how it gets from where we place it to the systemic circulation. So it's important to recognize that some drugs are meant to stay where we put them. And that is the case with local anesthetics. We want them to stay where we put them because that is the area that we want to be anesthetized. We want it to not feel, an animal to not feel things in that local area of the body. And topical insecticides or antibiotics, many of them are meant to stay, some of them may move through the skin, let's say, but in general, they're meant to stay on the outside of the body. And then some gastrointestinal drugs, particularly ones that are going after gastrointestinal parasites, we want them to act there, and they don't need to be absorbed. Their action is going to occur in the GI tract and not anywhere else. But in general, those are sort of exceptions, and I wanted to mention them, but we're going to be talking more about the ones that we do place and need them to get into systemic circulation. So that really is what absorption is. It's going from where we place it into the bloodstream. So there is something called a concept called bioavailability. And bioavailability has to do with how much of a drug gets from where we place it into the systemic circulation. Bioavailability is abbreviated, if you will, or noted as the letter F, capital letter F. And we say that a particular drug given in a particular manner of administration could have an F of 1 or less. 1 is 100%. So if our definition of absorption and really bioavailability is how much gets into the bloodstream, is if 100% is 1, then intravenous administration or intraosseous, so intraosseous is giving a drug into the bone and into the medullary space in the bone. And we do that sometimes with really little animals that we just cannot get an IV catheter in or get a needle into a vein very easily. We can sometimes put a fairly large bore needle into the femur of, say, a small animal, a hamster or a bird even, and administer a drug that way. That area is very vascular. If you remember, that's where blood cells are developed, and so it is essentially putting it into the bloodstream. So IV or IO administration of a drug gets it right into the bloodstream, so that's 100%. So that bioavailability would equal 1. Intramuscular administration. So muscles have, depending on the muscle, but most of them have a lot of capillaries and blood vessels in them. That's what gives them the red color. That's why they bleed a lot when we cut into muscle. And so that area is very close to 1. I'm not going to give exact numbers here, but because it is so vascular, it is very close to 1. Once we get it into the muscle, it's going to pass pretty easily into the capillaries and into the bloodstream. And lastly, oral and sub-Q kind of go together. And those, as you can imagine, take more steps. And there's more possibilities of drugs not making it into the bloodstream. So oral administration, we have to get it into the gastrointestinal system where it is absorbed. There are a few things that are absorbed across the oral mucosa, but for the most part, drugs that are administered orally they may have to dissolve, get out of a capsule, a tablet might have to break down, and then that drug needs to be absorbed across the gastrointestinal mucosa and then into the bloodstream. And that's more complicated and things might get left behind. We'll talk more specifically why that is as we go along. And the same thing for subcutaneous administration. It will be the subcutaneous space is not usually that vascular, so you don't bleed a whole lot if you just get a very superficial cut. And so that takes a little bit for it to get to between the cells and over into maybe a muscle mass area and be absorbed. So that bioavailability might be more like 70%. It really does depend on the characteristics of the drug, but definitely less than 1 is what we would put it as. This is a graphical representation of bioavailability. And you can see we have 3 different lines. This is the IV route in purple and intramuscular, and this is subcutaneous or oral. So the thing that you note about the IV route is our blood plasma concentration goes up very fast. It doesn't stay here for very long. It starts to be cleared pretty fast, and the total amount of time it spends in the therapeutic range, so the therapeutic range is between here and here on the concentration level, and this is the time that it spends there. It doesn't stay there for very long. We also get into the toxic concentration area because it's not there for very long. It probably won't harm the animal. We would not be giving a drug that could do that. Preferably, we wouldn't be giving it IV because of that if it had a definite, ill effect on the animal. So it the concentration goes up very fast. Bioavailability is 100%. It's right into the vein, and but it doesn't stay there for very long. So then we have the intramuscular route. Again, we go pretty fast. We get up to a high level concentration into the toxic area again. We don't stay there for too long. Um, and the total time that we're in the therapeutic range is longer than giving it IV. And then lastly, giving a drug by subcutaneous um, or an oral route is going to take longer for that drug to get up to the therapeutic range. It's going to stay in that range for the longest here. We're pretty close to this distance for the IM route, but it's never going to be super high in concentration. So less is bioavailable to the animal. So when we talk about giving drugs and the plasma concentration, I just wanted to clarify that. So hopefully in your ClinPath class, you have taken blood and you have spun it down. And if you took a close-up, you would see this. You would see the clotted blood in the bottom of the tube and the serum here. And when we do run blood tests, we typically do remove the red blood cells and white blood cells. And we're just looking at this serum part. So when we talk about that, about serum, that's what we're talking about. That's how they will measure that in an animal.